I'm hoping that you've all been able to synthesize the discussion and bring it together into one comment. Fiona has assured me that this is all going to be written up, collected and written up. So what you've discussed and what you've written up is not going to be lost. I would suggest that if you hear something that reflects your key point, you quickly choose something else and take the opportunity. But I'm going to go with what's easier for me. I'm just going to start at the right of the room, and can we go somehow? And I keep forgetting I shouldn't walk away from the microphone.
Okay, so our point was the tools are great. So how can we make them more digitally available so that they can be adjusted and used by different people? So thinking about if you were a university student, how can you make sure it links to your CPD?
Can you just, sorry, to help, thank you. I keep forgetting about that's my fault.
So how can we make the tools more digitally available so that they can be adjusted for use either by individuals or teams, and we'd be able to save it online? And we understand that NES has an online platform called Tourus, which we think could be an opportunity possibly for those to be uploaded to.
Okay. Thank you for that. Can we just go, if you carry the microphone, that's a really good way of getting around the room. So we'll go from table to table with the mic that way.
Well, I think it was a bit difficult for us to settle on one thing, but I think the main thing was about being very positive about how the framework is going to support people. That we sort of hit the nail on the head that it's not a negative thing, that it's not about making people have to apply for registration, that it's there to support people to identify their skills and their experience and use that in their career progression and to support them in their own development. And Gabe, one of the points that you brought up was about how we utilise the framework in all the various different sort of pieces of work that are going on, and being clear about what the needs are for each of those. Did you want to say anything else about that?
As you call passing the baton, from there. I suppose, Michelle, what we are basically saying, the framework's actually very good, but there's a whole lot of things happening just now. We've got the workforce development group, we've got the public health review, and potentially, how can we feed it into all the things which are happening, the stuff which is happening with postgraduate nursing, all these type of things. So the trick is how we actually feed it in. We've got a tool, but it has to get put into the system. Yes. If not, it's going to sit up here and they're not going to use it.
Yes. There's a team of people that are going to be doing that. Thanks.
Thank you. Our one key point is that we should be considering embedding and formalising the framework into core local and national decision making, maybe using practical tools for practice, for recruitment, for staff development, and taking care to articulate the skills and knowledge for the core and the wider workforce. One key point.
Great, thank you, Pauline. Do you want to come to table 6 next?
Cheers, thank you. I guess our point is very similar to the two that were described just a moment ago, but I guess it was about appreciation that the opportunity for this is that it could be the golden thread that links a number of these developments or links to some of these national developments. But I think we also described the appreciation that it's not going to happen by chance, that we need to be deliberate, there needs to be leadership, coordination, and it was about that national and local again. And also an appreciation of there being value in having a clear infrastructure and process to support implementation of it.
Yeah. Great, thank you, Wendy.
Hi there. Our group had talked about how user-friendly it is compared to the last cube, and how empowering it is for people that maybe don't have the academic qualifications that some do to evidence their skills. What we kind of talked about was the national lead. We really need that strong leadership so that it doesn't just sit there on the shelf not getting used. And the inclusion, we had some a third sector person around the table, which was really good, talking about the importance of making sure the third sector continues to be included and using the framework, even if that's applied to local groups sitting around using the framework and seeing what the common skills are around the table and looking at what opportunities they can use then to develop themselves. We talked about the long-term conditions group, even sitting around multi-agency groups around a table and having sessions where the framework's used to pick up on that.
Great, thank you.
Our group talked about the wider workforce, and we felt the framework could help the wider workforce to recognise their valuable part in the public health family.
Thank you. Thank you.
Thank you. Our group said that the framework offers an opportunity for consistency over a number of areas and should commit to testing it out and then changing it if we need to.
Our group focused on workforce planning, and we felt this was an opportunity to use the framework to plan for both the current and future workforce, and identify key areas of focus, staff development, and indeed what new roles we need to take the agenda forward.
Our group said everything everybody else said, but I'm still going to get my tuppence worth in. Tourists was really getting a big sort of shout out today and a big sort of promotion around digital literacy. But our top one was use the framework to create dialogue about health inequalities and reinforce that it's all our priorities, and to look across the wider public health workforce, including strategic leadership, and identify resources to illustrate further practical examples.
Great. That's been something from every table, hasn't it? I don't know what you all think, but I think those are great key points. And there's some commonality and some challenges to pick up on and help us focus. We do anything else that anybody just wants to add to that? Okay. Thank you for all that. There's obviously been a lot of energy. I keep saying that, but it's really true. You've been thinking hard about and listening to what was presented and thinking about how we might go forward with this. And that does kind of bring us to the point in the day where we're starting to close down and reflect on what has been happening in this room today and the learning from that. And I would like to just maybe offer some of my my reflections and comments. And I would like to start by saying that I think we've had excellent presentations throughout, without question. I think there has been lots for us all to think about. I think the last hour has been reflective of that. There's been, as I say, huge discussion going on, and there will be more. You'll go away and you'll think about things. There'll be further questions. I think the point earlier about this being an iterative process was important, because we've got something, we're reflecting on that. There's further development. What are we going to do with it in Scotland? All those and further engagement and opportunity. I also think the point that's been made a number of times about distributive leadership, that's a mouthful at this, but I also fully believe in that. It's leadership at all levels, whatever level somebody is working at, because it's not just for the most senior people. We must be looking at that, because we're working at a time of transformational change. We've mentioned earlier today, and just a reminder, the review of structures, new organisations, new roles, and the outcome of all of that isn't always clear. I mean, that's what transformational change is about, and we're in the middle of that with this public health agenda and looking at the workforce and what sort of a workforce do we need in the future. It needs collaboration, and that's also something that's been said over and over again by a number of people. The learning from others. We had some reflections in the presentations, but there's lots going on around Scotland. We need to learn. We must not reinvent wheels everywhere. I think we could do more in terms of sharing that learning and offering it to other places. So, and I think also some of the comments earlier today, again, about the core workshop. Oh, sorry, I keep doing that. The core workforce and the wider workforce. And that has run through today. Somebody used the term earlier, the golden thread, but I think it runs through because of the challenges that we have. It can't just be the core, it needs to be the whole workforce. So there's a lot to consider, and I think this is the start for us and the contribution that can be made in terms of the challenges that we face. So as we now conclude the day, I want to note that all the presentations are going to be made available. I understand it won't be in the next day or two, but it will be in the next week or so. You'll also receive a request for feedback, and I would encourage you to complete that because that's part of this iterative process, and knowing we've got lots of information from today, but we need, I keep saying we, it's not me at all. It's I'll be part of it somewhere along the line, but we need to get that feedback and understand how we can go forward with this, and that continuing engagement. I have noted that the comments, questions are all going to be collated, and there will be a short report from today, which will be shared with you all, and it will also be shared with the Scottish Public Health Workforce Development Group for consideration. So that does bring me to, I want to thanking a number of people. I want to thank all the contributors, the speakers, the facilitators, and you, the participants. I also want to give a big thank you to the staff, and I don't know about you, but I think it's a great venue. It's one I've never been to before. There's been plenty of light in the room, and it's a good-sized room. So I think I said I wanted to thank a number of people, and actually hopefully I've thanked everybody, because that's what I want to do. It has been a pleasure to chair today, because I think these are exciting times for public health in Scotland and the UK generally. And we're trying to embrace all of that. I hope you'll all go home energised. And it just leaves me to finally wish you all a very safe journey home. We finished early, which I think is always a good thing. So thank you all.